Welcome, everyone, to the 23rd Annual Conference of the National Academy of Social Insurance. I'm Virginia Reno, Vice President for Income Security at the Academy, filling in for Lisa Mensa, our board chair, who is on her way through the slick roads of Washington, but is not here yet. I want to begin by acknowledging our conference co-chairs who have put together an excellent program for the next 2 days. Two of our co-chairs are here, Bill Hoagland and Avis Jones-DeWeaver, and Larry Jacobs is on his way from Minnesota and will be here later today. Bill Hoagland is Vice President of Public Policy at Cigna, and he leads development of that company's policy on healthcare reform issues. Prior to moving to Cigna, Bill worked for 33 years as staff in the United States Senate. Larry Jacobs holds the Mondale Chair for Political Studies at the University of Minnesota and is also director of the Center for the Study of Politics and Governance there. He's published 11 books and dozens of articles on politics and public policy. His most recent books is Healthcare Reform and American Politics, What Everyone Needs to Know, co-authored with Theda Skocpol, who will be speaking to us tomorrow. Avis Jones-DeWeaver is Executive Director of the National Council of Negro Women. Her work examines the causes and consequences of poverty on low-income women and families and identifies strategies to reduce poverty among all Americans. Jones-DeWeaver has authored or co-authored numerous publications, including When the Spirit Blooms, Acquiring Higher Education in the Context of Welfare Reform. With their diverse backgrounds, our conference co-chairs have assembled an excellent program, and I want to thank all three of them for their excellent work. Our economy and our society face difficult challenges, and we face new risks in retirement security, health care coverage, unemployment, disability, and long-term care. NASI believes that our social insurance programs are a big part of the solution to these problems. We've asked some of the nation's best experts on social insurance to diagnose the challenges and point the way towards some good solutions in the coming 2 days. Tens of millions of Americans will be heading into retirement in the coming decades without sufficient resources. Solutions to the retirement shortfall will be explored at our kickoff session this morning featuring Chuck Blahaus, Andy Stern, and Janice Gregory. A roundtable tomorrow morning and a debate tomorrow will also look at retirement issues. Our unemployment insurance system has provided critical support to families during the Great Recession. Yet it faces challenges in funding, coverage, and benefit adequacy. These problems and potential solutions to them will be explored at a session later today and at a roundtable tomorrow morning. Finally, the implementation of landmark healthcare legislation of 2010 is a new challenge for many. The hard work of converting legislative language into policy reality is underway. NASI has a blue ribbon study panel to assist the states in designing state-based exchanges, a key part of that reform. A model statute with legislative options will be released tomorrow morning. Tomorrow afternoon, we will hear from Secretary Sebelius about the progress of health reform, and we'll have a panel of federal and state health insurance experts. In this difficult economic and fiscal environment, finding wise solutions to our social insurance challenges is more urgent than ever. Thank you all for taking the time to come to this conference and engage in the discussion. We've allowed time in each session for the audience to pose questions and comments. To do that, please go to one of the standing mics in the room or raise your hand and a portable mic will be brought to you. Do also visit our book exhibit, which features the newest books from NASI membership. We have over 900 members, and we have lots of new books from our members. Finally, I ask you to see us again throughout the year as NASI plans a series of events to mark the 25th anniversary of this organization. Now, I'm delighted to introduce our opening keynote speaker, Kenneth Feinberg. Ken has been key to resolving many of our nation's most challenging and widely known disputes. He now serves as administrator of the Gulf Coast Claims Facility of the BP Deepwater Horizon disaster. Before that, he served as Special Master for Executive Compensation for the Secretary of the Treasury. He also served as the Special Master of the Victims' Compensation Fund after the September 11th attacks. And from that experience, he wrote the memorable book, What is Life Worth? A full bio for Kenneth and for all of our speakers is in your material. So without further ado, I'll turn it over to Ken.
Thank you very much. Virginia mentions my book, What is Life Worth? Public Affairs Press, 2005, now in paperback. Now, if you have trouble finding that book at Borders or Barnes & Noble, don't worry. My personal supply of my book is virtually inexhaustible. So just let me know and we can work something out. I want to thank Virginia. I want to thank Janice and Pam Larson. Janice Gregory and Pam Larson, they've been corresponding with me and trying to get me here. Getting me here is not an issue. It's not an issue. This is the third time I've met with the National Academy and its members. And there's a reason for that. And that is I have a real affinity for what you do. And a real recognition of the importance of what you do. Understand, Virginia mentions these mass disasters where I get involved, Agent Orange, 9/11, Virginia Tech, BP oil spill. These are very, very interesting assignments where, for one reason or another, either publicly or privately, policymakers carve out of the regular way, conventional way we resolve these claims by setting up a very unique, unprecedented third way, you see, to resolve these claims and pay compensation. And I'm frequently asked, well, when you've got $20 billion to spend in the BP oil spill disaster, unlimited billions of taxpayer money to resolve 9/11, corporate money paid by the manufacturers of Agent Orange chemical in Vietnam to pay claims, aren't these wonderful precedents that ought to be expanded and used more frequently to buttress or complement social insurance? No, they are not precedents for anything. As a practical matter, what I do is unique to a particular nationally recognized tragedy. So, after BP sits down with the administration and agrees to fund a $20 billion claims program. After 9/11, Congress passes a law that will never again be enacted, I don't believe. A law that basically says unlimited taxpayer money may be used in the individual discretion of an administrator to pay claims instead of going to court. BP pay the claims instead of going to court. Agent Orange settle the claims instead of going to court. But these programs that I get involved in that Virginia references are really aberrations. What you do every day is the real safety net for people. These specially funded programs that I'm engaged in are one-off programs. They're precedents for nothing. I'm asked all the time, gee, this is a fabulous program. Why don't we use it to deal with other disasters, airplane crashes? Why don't we set it up for disease and pharmaceutical lawsuits? And Well, who's going to pay for it? The BP program that I'm administering now, I think, is going to be a huge success. In 5 months, we've already paid out $3.5 billion to 180,000 people in the Gulf who document lost income and wages as a result of the spill. It's fabulous. But we have $20 billion, you see. There's no argument over who's going to fund it. 9/11, we paid what? We paid almost $8 billion to 5,200 claimants. All tax-free, taxpayer-funded money. Well, it's wonderful. But what about all of the other misfortunes? All of the other curveballs that confront the American people? There's no BP fund. Bad things happen to good people every day in this country. That's where you come in. So, I'm a complement to social insurance. I'm a one-off aberration, the way things are done. And I doubt very, very much that what I do is much of a precedent that can be used going forward. Well, there may be an explosion next month or a hurricane or a disaster. And, you know, the master of disaster gets involved. But those programs that are set up are very rare, very, very rare. There was no Katrina 9/11 fund. There was no Oklahoma City 9/11 fund. Death, physical injury, financial uncertainty, the social insurance safety net is the lifeline, you see. It's the lifeline. So that's my first point, as sort of a keynote from 30,000 feet point. I am a social insurer in a handful of cases. In a handful of cases. And they gather a lot of public attention because of the nature and the quantity and quality of the disaster, you see, that scars the public psyche. But I must say, I am certainly, and these programs certainly are not a replacement for what you do day in and day out of the public eye, largely out of the public eye, and do with such importance. I mean, the impact. I mean, I love the National Academy, the work you're doing. In a modern society, you guys are the lifeline, not me. I paid 180,000 victims of BP's oil, of the explosion. 180,000. I denied 275,000. Ineligible. No documentation about your loss, no evidence you were harmed. It's a very, very, in the relative scheme of things, what I do is important, very public, and in the relative total scheme of things, hardly a substitute for what you do. That's point one. Point number two is the interesting problems I run into with social insurance in doing my work. It's very pronounced in 9/11 and BP. In 9/11, here was the tension. Congress passes a law, and the law creates this great fund, funded by the taxpayer. No appropriation. No appropriation in 9/11. The authorizing legislation basically said, Feinberg, whatever you need to spend, take it out of petty cash from the U.S. Treasury. No appropriation. But the law did say, as you know, in deciding how much to pay people who lost loved ones or are physically injured by 9/11, make sure you deduct collateral sources of income. Now that gets us into a very thorny problem, you see. Very thorny. Mr. Jones, you lost your wife in the World Trade Center, and we've calculated the damage, and we're going to give you gross $2 million. But your wife died at work. You're receiving workers' compensation benefits, death benefits, for her work life. Those have to be deducted. By law, collateral sources of income caused by 9/11 shall be deducted. So we have to deduct from your gross award workers' comp. Back comes the claimant's lawyer. Oh, no. You can't deduct that because under the state of New York workers' comp law, or 28 other states where people died in 9/11, whatever we get from the 9/11 fund, we've got to reimburse the comp carrier. So if you deduct comp from your award, and then we got to pay back the comp carrier, that's a double whammy. So you better not deduct it. Comp carrier, what do you say to that? Well, we haven't decided yet whether we'll seek that money. It's a rather unique situation, and BP is a unique situation, and Agent Orange is a unique. This isn't on our radar screen, these special programs. So either we aren't sure we're going to deduct it, or seek reimbursement, or we're not going to seek reimbursement. So I didn't deduct it. I decided in 9/11 it's sufficiently unclear what the comp carrier is going to do. We won't deduct it because there's a chance that the comp carrier will seek reimbursement. Big problem in all of these cases. Now with BP. The problems are the same and a little bit different. One problem we've got with BP is a lot of these individuals have private comp. It's not a public program. So even gathering the information is very, very difficult. If the claimant doesn't state on the claim form other sources of income, we may not even know whether there are other sources of income coming in, social insurance. We may not even know it, especially if it's a private business with private comp. So this problem, then we run into this other problem. We may not know it. Now we get all the information in, and we check, and before you know it, state agencies and the federal government, dear Mr. Feinberg, please provide us any information concerning the compensation paid to this individual governing his loss as a result of the BP oil spill. We have collateral claims here by that individual. We want to know the total picture. Individual, we're going to send, don't you dare send that information. That's confidential information provided the claims facility. If I knew you were going to send any information to any other agency, I wouldn't file a claim. You have no idea the number of claims people file with the Gulf Coast Claims Facility in the Gulf. Works like this. Mr. Feinberg, I've lost wages, $60,000. Here's my documentation. Here's my documentation. Okay, Mr. Jones, you seem to have adequate documentation. We're going to pay these $60,000. Now you know we're going to send you a 1099. I withdraw my application. I withdraw my application for the $60,000. Why? I don't want any I waive the 1099. You can't waive a 1099. I mean, This is, you see, these are, my final point, then we'll take questions. These are two very practical problems. The first point I make is from 30,000 feet, the role we play and the uniqueness of what I do. But the second 2 points, the second and third points, are very fascinating problems. Point number 2, how do we interface the payments with collateral sources of income? What do we deduct? What don't we deduct? What do we recognize as collateral? What don't we recognize as collateral? Waivers versus no waivers, you see. The third problem you deal with every day, the tension between the need to gather information in order to make a credible payment from one of these unique funds, only to find that there's a tension between the confidentiality of seeking the information and the fact that other agencies are mandated by law to get that information, and how that tension develops and how we try and work through it. So those are a few. Virginia says, take your time, Ken, you've got 15 minutes. Thank you, Virginia. But let's save 15 minutes. This is the best part for me, best part. Questions from the pros. You see, I roll in and roll out. You guys deal with these problems every day, and you're so critical to all of this that I'm honored to be invited by the National Academy, because you guys are laboring in the vineyard and doing a spectacular job in terms of protecting the future financial security of citizens that, out of the public eye. So I'm glad to be here, and we've reserved time, and I'm playing by the rules. Thank you very much. Questions?
Thank you, Ken, for sticking right on time. And we do have time for questions from Ken. We have microphones on the floor, so please go to the mic. And because this is being recorded and we want a complete transcript, tell us who you are and where you're from. And there's also a handheld mic if you want one brought to you. Just raise your hand. Over here?
Yes, Bill Arnone. I'm a founding member of the Academy. Even though, Ken, you've caveated the relevance of your experience to social insurance, you probably have the most vivid perspective on the administration of a needs test. And many now believe that some type of needs test or means test might be compatible with Social Security. And this is an opinion that is shared by some who are very conservative, others who are very liberal. And yet others believe that means tests are inherently demeaning. They're inefficient and they're costly. From your perspective, since you've been there, do you see any way a similar approach could be incorporated into Social Security?
Isn't it inevitable? The problem you run into in my needs arguments, it's a little bit different from Social Security. The simple answer for needs testing to me is, can you develop, I worry when you say inefficiency, can you develop objective criterion that define need? You see, that's the key. Because in the programs I run, where people roll in with a claim and roll out with money, if I ever tried to impose a true needs test in these programs, I would be vilified. I was in 9/11 when I made the mistake of even suggesting to a widow, you don't need $8 million for the death of your husband. Answer? With all due respect, Mr. Feinberg, who are you to tell me what I need? Have you met my 3 children? Do you know that if I have to sell that home on Long Island, that's the only place they can go to for peace? Don't tell me that I don't need to send my kids, I don't need to send kids to private school, et cetera, et cetera. You've got to take the question of need out of subjectivism, where you've got bureaucrats, a good word in this sense, bureaucrats evaluating claims in their discretion, and have a rather formulaic approach to what constitutes need. But the other problem is human nature. I watch this. People have an expectation of entitlement, trying to tell people that that expectation by necessity is going to be modified. Whoa, the need test better be prospective, and it better be far enough into the future so that that expectation can be dealt with. Otherwise, you run into a huge problem. So, yep, I think need as a public social matter is inevitable. But how you get there, objectively, prospectively, that's the challenge.
Scott Simondera, Congressional Research Service. As you know, and maybe you will be intimately involved with, the 9/11 VCF is reopened for 5 years. Can you just talk a little bit about what you see the potential problems or issues that are going to come down the road with the reopened VCF?
We're with you a potential list of problems. Let's start with the following in 30 seconds. That 9/11 legislation that was just enacted into law, unlike the original 9/11 fund, has an appropriated amount of money. That's all there is. There ain't no more. So when you start allocating that money, inevitably people are going to say you're taking from Peter to pay Paul, my next door neighbor. Good luck with that problem. That's a huge problem. The reason you're giving me this is because you got to save enough to give it to her. That's problem number one. We had no appropriation. Petty cash. Much easier. Second, people who were denied a claim back in 2001 will now reapply if they can, saying the regulations back in 2001 are different from the regulations under the new statute. I was denied then, I ought to be able to claim now. That's a second problem, expanding the scope of eligibility. Third problem, we had regulations in place that limited physical injury claims to the World Trade Center, Battery Park, West Street, Canal Street, and South Broadway. Not now. That legislation says, I think, it's not just for first responders, it's for residents of Lower Manhattan. You're going to have so many people filing a claim that to what extent, question mark, is the money insufficient to pay all the eligible claimants? Then there's the problem of medicine and ineligible claimants. I'm told that 95% of these claims will be respiratory claims. Cancer, lung cancer, emphysema, other cancers. Does the medical evidence prove and corroborate the validity of the claim? It's 4, 5, 8 years later. I mean, be careful what you wish for. It'll be, I don't know whether I'll be involved or not, but I mean, it's an interesting assignment. The law leaves a great amount of discretion. Clearly, these responders are entitled to compensation. The only reason they didn't get compensated back in 2001 is they didn't manifest an injury before the statute expired. So there's a very, very fair argument to be made that these responders should be compensated, that the law should be interpreted in a very liberal way to maximize eligibility. I'm very sensitive to that. On the other hand, there's only so much money. And if you let people reapply, there's even less money to deal with those who never received any payment. So there's going to be a lot of issues raised. But I'm very sympathetic to the claims.
Mr. Feinberg, Frank Newhauser from the University of California. I have a question about about two solutions to a problem. So there's, you mentioned Agent Orange, which I'm not familiar with. I don't know the parameters of that program. I am familiar with the childhood immunization solution, where you basically have a standard payment and to make that much more efficient. And those would seem to be very different solutions than we've come up with for asbestos, which has, been a fabulously expensive administrative and litigation-prone process. If something like this arose in the future, how would you get a solution like the Agent Orange solution or the childhood immunization instead of the solution like asbestos?
Find somebody to pay for it. Start with that. BP stepped up $20 billion. The taxpayers stepped up in 9/11, $9 billion, $8 billion. Virginia Tech, 33 dead, $2 200 students physically injured, private contributions. Agent Orange, 250 million, 8 chemical companies, Dow, Monsanto, etc. First, find a funding source. The problem with coming up with a national asbestos program is that it's very, very difficult to get everybody to agree on who to fund such a program. The manufacturer blames the employer plays the manufacturer, the insurance companies don't cooperate on a common plan. It's very, very difficult. It's very, very difficult. Then, after you've got the funding, you raise an interesting question. It is very inefficient to ask anybody, whether it's me or anybody else, to look at each claim one by one and calculate different amounts. That's the tort system. That's what you mirror the tort system. That's one way to do it. 9/11. Everybody gets a different amount in return for releasing their right to sue. I prefer everybody gets the same amount. Then the only thing is verify the address and make sure that the person was injured by the product. That's much easier and much more efficient. That's what Congress enacted in the firefighter and police legislation. Been on the books for 40 years. Any fireman or cop killed in the line of duty, the family gets a flat amount. That's it. Doesn't matter the circumstances, the wealth, the age of the victim. $250,000, now I guess it's a little more because of inflation. Flat. A lot easier. Congress said no in 9/11. You figure out each individual, 5,200 people. Huh. You guys are all experts. I could give you a packet in BP or 9/11. Here, everybody, take the same packet, the same information, calculate the award. We'd get 200 different amounts. So it's tough, it's inefficient, and it puts a tremendous amount of burden on who's ever calculating these awards, you see, and the offsets. And do we deduct workers' comp, etc. That's why it's so rare, you see. These programs that I've got involved in are rarities. 3, 4, 5 of them in 25 years. And the type of disaster is no guarantee that there'll be a program like I administer. Katrina, there wasn't. Oh. Yes.
One of our co-chairs has a question, Avis, and then I also had a question. So go ahead, Avis.
Sure. Actually, your final remark relates to my question. I find it very interesting that given specifically with regards to what happened to New Orleans was a failure of the levees and not merely an issue with the hurricane. Can you describe to us the politics behind what is funded and what is not?
I think the politics is overwhelmingly against carving out for very special treatment only a relatively modest number of people harmed by life's misfortunes. It's not the American way. And I don't see any animus, racial or otherwise, in Katrina as a reason not to have such a program. It's the opposite. 9/11 was a unique catastrophe, rivaled only by the American Civil War and Pearl Harbor and perhaps the assassination of President Kennedy. Congress stepped up, bailed out the airlines, no suits, in order to come up with a program like that. BP, the worst environmental tragedy in American history. BP on its own, at the request of the United States government, will set up a funding program. In Katrina, a horrible natural disaster, one of the worst in American history. Well, bad things happen to good people. There wasn't a incentive or a desire for the United States government or the Army Corps of Engineers to set up a BP program. They might have, if there had been more political or national outrage, perhaps. But I must say, It's the opposite. A 9/11 program is so unique and so unprecedented. I don't think it'll ever be repeated, not like that. It took a tragedy that scarred the psyche of the people of the United States to set up a program like that.
My question is a little bit different, and many of your, the thorny issues you've had to deal with are victim compensation in lieu of suing somebody who has deep pockets. The other one of your special masters was executive compensation, which is quite different, it seems to me, from victim compensation. Can you draw a connection between the two?
It's the last part, draw a connection. I mean, the connection, of course, is the American people are fascinated by the subject of compensation. When I was over at Treasury setting compensation, that was done pursuant to a federal statute, populist anger. Congress bailed out these companies and said, well, we bailed you out, we're your creditor, we saved you from bankruptcy, we have a right to control top executive pay, and we delegate to the Secretary of the Treasury, who delegates to Feinberg. You do it. You do it. Now, I would have thought it would have been very controversial, what I did. The government setting the pay of private corporate officials. You'll make $2 million. You'll make $5 million. You'll make $800,000. You'll make... I took that assignment and I said to myself, whoa, batten down the hatches, this is going to be a bumpy ride. Nah, very little criticism. Two reasons. One, it was a sideshow. I only had authority to set the pay of the top 25 people in 7 companies. Symbolic, to a certain extent. So it wasn't, I mean, if you're going to aim your sights on attacking government interference in private setting of compensation, you know, save it for something that's going to be much more pervasive than Feinberg controlling the pay of, you know, 175 people. Second, I must say, the American people and the Congress was so angry at bailing out these companies, they said basically, we own you, we're your creditors, we have every right to set your pay. Just don't expand Feinberg's jurisdiction. But as to these companies, by what right do they argue they shouldn't have their pay set? We own you, we saved you. We have a right as a creditor to set your pay. And I found that most elected officials, most policy makers, most citizens agreed with that. So it turned out to be not as controversial as I thought it might. So there we are. The 0 is up for minutes. I'm trying to set an example for others to emulate. I want to thank everybody. A tough travel day, and if I'm invited back, I have the utmost respect for what you do. My goodness. And it's an honor to be invited, so thank you very much.
Okay, I think we're going to move right into our next session.